Good day, ma'am. So we are here to discuss about the antipyretic drugs. So what is antipyretic drug? From the word anti meaning against and pyretic meaning from the word pyretus meaning fever. So the same root gives rise to pyrexia, a medical term for fever. And it is also known as antihermic and antifebrile. So before we proceed to different kinds of medicine, we must first know how the pyrogens occur in our body. So it starts when certain invaders enter our body, such as microbial infections. Under that are the bacteria, fungi, pathogen, a disease-causing agent, and a virus. And so when one of these will enter to our body, we have the WBCs in our body that act as a tunnel that they roam around our body and looking for invaders. So when they detect that we have those invaders, they go to a certain area and the white blood cells come in contact with the invader. It will produce a substance or chemicals known as pyrogens, and the pyrogens will go to our hypothalamus, which regulates our body temperature. And when they reach the hypothalamus, they will bind to a certain receptor and they inhibit the heat sensing neurons and activates the cold sensing neurons. So the hypothalamus will react by heating up our body.
Patuloy.
Acetaminophen can be used as analgesic and antipyretic. It's a painkiller and fever reducer. It can cure minor ache and pain due to headache, toothache, muscular ache, or backache. Pwede din siya for minor pain of arthritis. Mechanism of action in pain. There are 3 neurons of pain pathway. For example, if your hand is in severe pain, the neurons will travel to the spinal cord, and from spinal cord, it will travel to the thalamus. The neurons will take the message to the brain, and the brain will interpret it. There's a pathway from brain to the spinal cord. We call that inhibitory pathway. The spinal cord serves as a gate for acetaminophen because most of the time acetaminophen works in there. The job of acetaminophen as analgesic and as antipyretic. For analgesic, it will reduce pain by helping to block the pain signal to the brain. For antipyretic, it will reduce fever through its action on the heat-regulating center of the brain. It will tell the center of the brain to lower down your body's temperature when the temperature will elevate.
So after acetaminophen, the second classification of antipyretic drugs are the NSAIDs. NSAIDs or non-steroidal anti-inflammatory drugs. So it acts by inhibiting an enzyme called COX or cyclooxygenase. So cyclooxygenase is produced when there is, let's say, inflammation in the body. The inflammation produces phospholipase A2 and then converts it to arachidonic acid. Arachidonic acid then transforms into cyclooxygenase. So cyclooxygenase has 2 kinds. First, the COX-1. So COX-1 is always expressed in our body, and COX-1 is involved in the creation of prostaglandins and thromboxane. So prostaglandins are involved in the creation of the stomach lining in our stomach, and also the thromboxane is involved in the aggregation of our platelets or the clotting action of our platelets. However, during inflammation, our body creates more prostaglandins, therefore the creation of COX-2. If there is too much prostaglandins in your body, your body reacts by heating up for having extreme or mild pain, and also further increasing the inflammation. So to counteract those effects, NSAIDs are antipyretic, analgesic, and anti-inflammation. So there are 2 kinds of NSAIDs. First is the non-selective. So non-selective NSAIDs inhibits both COX-1 and COX-2 enzymes. So it stops the production of prostaglandins. However, when you inhibit the creation of prostaglandins, you have a high chance of stomach ulcers because prostaglandins are also in charge of creating the stomach lining in the stomach. Next is the COX-2 inhibitors. So COX-2 inhibitors, they inhibit, unlike non-selective, they inhibit the COX-2 inhibitor only. However, since you inhibit COX-2, you also inhibit, there is an unbalance between the prostaglandin and the thromboxane. So if you inhibit COX-2, there is a high chance of stroke since the thromboxane levels are now higher than the prostaglandins. So
Go.
so what if you have a heart disease and you don't want ulcers? So the solution for that are salicylates. So salicylates are or esters of salicylic acid. So like NSAIDs, they have the same effect. They are antipyretic, analgesic, and anti-inflammatory. So usually the salicylate that is in charge of for having antipyretic effects or like same effects of NSAIDs is the aspirin. So unlike the mentioned NSAIDs, aspirin inhibits the COX-1 enzyme. So if you inhibit the COX-1 enzyme, you will reduce the prostaglandin levels and also reduce the effects of fever. However, since COX-1 is involved in the production of thromboxane, your platelet aggregation is now low, meaning you are now more prone to bleeding. And that is all. Thank you.